Hello everybody, this is Paul from Ortho, Eval. With me I have my friend Sean. Sean is 54 years old, and the reason I'm doing this video today is to talk a little bit about why stiffness in the knee can cause so many problems, okay? Sean has had an ACL reconstruction over 30 years ago, and he had one on the other side also, how long ago?
Over 20.
Over 20 years on the right side. So he's been complaining of, increased knee pain bilaterally, difficulty squatting, can't run much anymore, and likes to be very physically active. So I just want to show you, what this looks like. When he had this ACL done, he had a lot of meniscus removed also, and he's generally developed this very, very stiff knee, okay? So one of the things I want you to notice right off while he's at rest is that he has this pretty significant lack of extension. And he does have some tight hamstrings, but it's not just being restricted by the hamstring. He has a lot of posterior capsular tightness, okay? The other thing I want you to notice is his peripatellar structures, okay, and retinaculum. So if I go like this, and he's relaxed right now, and I try to move his patella, I really have very, very little motion there, and I can push. Now I'm going to push really hard now, okay? Probably 15 to 20 pounds. And he feels fine with that. But after we do that for a while, he shows a significant improvement of his motion. We've had him on some low-load, long-duration stretching, gravity-assisted. We put 20, 30 pounds on this leg, and we elevate that ankle a little bit, and we just let that sit there. We do like 3 bouts of 5 minutes. I also will do some manual mobility. Now, you can't do this with everybody, but this is just to show you how tight the posterior capsule can be, okay? So, I take pretty much all of my weight. I wouldn't do this with everybody, okay? But I'm putting quite a bit of pressure, and you don't have any pain with that. Just a lot of stretching.
Right.
Okay? And that's, and then we get that knee down, and I just do some light, nice, low-load, long-duration stretching. We have different devices that can do that also, and he's done well with that. But he does best with the manual. So I do a lot of stretching into extension. He has adequate flexion. And when I do his patella mobilization, I use the palm of my hand, and I hold it there and get this nice low-load, long-duration stretch. And once we've done that, the patella works well, he extends better, and his quad fires off. If you take a look at his quad, go ahead and tighten. He has a nice, VMO, really nice, good, tight quad, but he gets it into better extension. Even after that little bit of stretching that I just did, I can now feel his leg on my hand. Okay, so we really are emphasizing that extension for much better function. Getting full extension is way more important, in my opinion, than getting extremes of flexion, okay, so that the quad and patella function better with squatting, with stairs, with all those functional activities you do every day. That's my tidbit for today. Patella mobility is important, but posterior capsular stretching is very, very important in regards to, improving quality of life and improving function. Now remember, this is just for education purposes. This is for medical providers, so you see that we can do this stuff with patients. Don't just go do this at home. You should be instructed on how to do this by a medical professional when you do these types of stretches. If you have any questions or would like to make any comments, please leave that at the underneath this video, and just shoot anything out you want at me, and get me at paul@orthoevalpal.com, and I'll be more than happy to answer your questions. Thanks.